to Nurse Talk. If you're new to Nurse Talk, welcome. And if you're an oldie, welcome back. Here on Nurse Talk, we talk about nursing trending topics. We like to dazzle in a little travel content in there too. So if that's something you're interested in, go ahead and like and subscribe and keep up with us.
Yes. So today we're talking about business ideas for the nurse entrepreneur. If you're sick of being at the bedside or working for somebody else, why not work for yourself? So these are going to be 5 different entrepreneur opportunities that you might be interested in.
Right. So as a nurse, you're not limited to just the bedside. The hospital or outpatient facilities is not your only calling.
Right.
As a nurse practitioner, you can always open up a private practice. If your state is a full authority state, you will be able to own it outright and be able to prescribe and do all that and treat patients. And if it is not, you will be able to work with a medical director and still own your own private practice.
Yeah. Number 2 would be a medical spa. That's really a big market right now.
Right.
And you can do this even as an RN. You don't have to be an NP. There is some misconception that that's what you have to do.
Right.
But as an RN or an NP, you can open this business. You can do injections like Botox and fillers, or you can do IV hydration and things like that.
So yeah, medical spas are the way to go. Another one is home care agencies. Home care agencies are always needed. Think about all the times that you have issues discharging a patient because there's nobody to take care of the patient when they leave. Yep. This is why you are needed. These home care agencies are going to bridge the gap for these patients, and you are not only going to be making this, but you're going to be stepping away from the bedside and still take care of patients.
And number 4 would be a cannabis agency. As we know, cannabis has been an up-and-coming drug that has been used for pain management, cancer, fibromyalgia, and the list goes on. Anxiety, depression, and so forth. So obviously getting into this business would bring you lots of money, and it would get you away from the bedside.
Yeah.
As legislation passes, more and more states are signing on to having legal cannabis. So it's not only for these things, it's also for recreation in some states. So this would give you even more profits.
Yeah, it gives you access to people that are sick and that need it, and then also people that are leisure cannabis users. So you have a really you have a huge market.
Yeah, that's a broad network.
Yeah. The last nursing entrepreneur job is a medical or pharmaceutical product sale. As a nurse, you have already knowledge from the field of working with these products, and that makes you the best salesperson.
Exactly.
You're able to say how they're better than other products, and you're able just to know what the use is for and how it would be better used in their personal facility.
Right.
So
we've seen these reps come around plenty of times, and they travel all over and demonstrate different types of products and
products.
Yeah, products.
Mainly products. Not so much the drugs. I don't think we get pitched to drugs. I think that's maybe pharmacy.
That's the doctor's offices. Because when I did clinical, they would come there, the pharmacy reps, and they were nurses as well. So yeah, and they seem to love what they did.
Well, I mean, it sounds like a gig. You're working. You're not. Probably not a 9 to 5.
Yeah, you just have to be a people person. You got to be able to communicate. If that's not your thing, then this probably wouldn't be the right job for you.
Right.
But you're not at the bedside.
Yeah. So these are all different things that you can do. You can do them in addition to working the bedside, or you can do them in place of working the bedside.
Yep. The choice is yours.
Yeah, the choice is yours, and we want you to know that you're not limited. As a nurse, I think we think that we have to stay in the hospital, but
no, there's too many options to be miserable,
and you get too many skills on the job just to use it in one place.
Right.
Use it everywhere.
Exactly. So like we said, this list it's only 5 of them just to get your thoughts rolling, but there's plenty of other options out there.
Right.
And as always, if you like this video,
like it.
Please subscribe.
Subscribe.
Yep. Hit the red button. And then also share.
Yeah. Yeah, if you know any nurses out there and they hate their job and they're thinking of other things to do, go ahead and send them this video. If you have stepped outside of the bedside and you started your own business, go ahead and share a comment below. Let us know what you started, when you started, and we want to know.
Yeah. Give us some ideas.
Yeah, because, you know, we out here too.
Yeah, exactly.
But thanks, guys. Thanks for tuning in, and subscribe so you can keep up with this.
Yep. And until next time.
Bye.
Bye.